This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Joining us on the show this morning is Dr. Wissam Gharib, cardiologist, and Jude Guess, nurse practitioner. Good morning, guys.
Good morning.
Good morning.
Guys, appreciate you taking...
Wissam Gharib and Jude Guess.
Jude Guess. You know what? I butchered, I think, both your names this morning.
That's all right. That's all right. Good morning.
And Dr. Gharib, I've had you on the show. I don't even know how many times. There's no excuse for that one.
Well, several times.
Well, guys, thanks for joining us here on a Monday morning. We'll get into the topic today. It's going to be lipid clinics is what we'll be talking about. But as we always do, we give our guests a couple of moments to share a little bit of background, share a little bit about themselves. Dr. Gharib, I don't know what we don't know about you at this point, so just remind folks a little bit about your background.
Good. I'll do a quick recap. So originally from Lebanon, by Nitro, West Virginia, close to Charleston. I've been in Morgantown since 1990. Did my training here, college, med school, residency, and fellowship. Been at Mon for 6 years now. And I was at WVU before that.
I don't think I've ever phrased the question in this way, so I'll phrase it in this fashion. What is so fascinating about cardiology?
The beauty of cardiology for me is that you really have a good connection with patients. You're able to see them when they present to you either with a heart attack or with chest pain or with whatever it is that they come to see us for. But then you're able to order the test. Most of the tests that we do, we keep it kind of in-house where we're actually doing the test, reading the tests, and then if you have to do a heart cath or if you have to send them for surgery, you continue that connection. And then after you're done with all those things that you've done, they come back to you and you get to see their progress. So you're really taking care of the patient more of a holistically rather than just sending them to somebody else to take care of them. Most of the stuff that we do, whether we're working with cardiology or with surgery, we work very closely together.
And just remind folks, where do you practice? Where do you see patients?
So I see patients here in Morgantown, but we have multiple clinics and multiple hospitals throughout the state. So I also have a clinic in Stonewall. But all of us here at Mon, we do outreach clinics. So that way we're out in the community taking care of patients, not just here in Morgantown, but pretty much throughout the state.
Our other guest this morning is Jude Guess, nurse practitioner. Jude, tell us about your background. Where are you from? Where'd you go to school? How'd you end up with Mon Health?
Okay, well, I grew up in western Pennsylvania and pursued my master's degree at Wheeling Jesuit. Fell into cardiology as I did my internships, and I liked general practice, plus my nursing background was in cardiac care. So started out at WVU, worked there for several years, and in 2018 I joined the Mon Healthcare team. And,
well, how do you like it? It's been... as I hit the microphone like a rookie. It's now been several years. How do you like Mon Health and, in your time there?
Well, I do enjoy working at Mon Health because of the personal touch you get. It's still very much patient-centered, where the patient's treated as an individual and a unique person.
You know, I was actually having this conversation just this past weekend about the differences between a nurse practitioner and an LPN and RPN. So what does a nurse practitioner, what is your role specifically?
Well, that can vary a whole lot depending on the practice you're in. But here in cardiology at the Mon, we are able to assist in the hospital with consults. We are able to help in the clinics and see patients in the clinics. In general, above nursing, we're able to prescribe medications, order lab tests, and interpret those tests, relay those to the individuals. So we have a pretty full and well-rounded approach to medicine for the patient.
Our guest this morning, Dr. Wissam Gharib, cardiologist, Jude Guess, Gus, nurse practitioner. Mon Health and Heart and Vascular Center offers lipid clinics. All right, what is a lipid clinic?
So I'll start, but Jude is really the one that's helping run this whole lipid clinic. So a lot of our patients, as you know, with cardiac disease, have elevated lipids. And for the vast majority of them, we're treating them with, medications, and they do well. However, a lot of patients aren't at goal. And so in order to help bring them to goal, in order to really be focused on trying to prevent the cardiac disease and slow it down, we need to be, more aggressive treating their blood pressure, treating their cholesterol, treating all their modifiable risk factors. Lipids happens to be a really big one. And this is why we've taken the initiative here at Mon to start a lipid clinic in order to help get our patients more to goal so that we can help reduce their risk, lower their chance of progressing of this cardiac disease. Now, Jude is the one been running it, so, whatever questions you have, he can go into more detail.
I want to get into a lot of detail about the clinic, but Dr. Gharib, before we do that, can you give a little bit of an explanation? What are lipids and what role, or good or bad, they play when it comes to the cardiovascular system?
Yeah, so lipids are extremely necessary. Cholesterol is extremely necessary for the function of our body. However, high cholesterol is the high cholesterol, that's the bad type of cholesterol. LDL is what really increases atherosclerotic buildup throughout our body. So we need to make sure that our lipids are balanced. So we want to look at patients' triglycerides, their total cholesterol, their LDL, which is a bad cholesterol, their HDL, which is their good cholesterol, and then we can get further down into the weeds when we look at several sub-factors of lipids. And that's what we try to do in the lipid clinic. Lipids are made mainly in our liver, and then we also consume it. So a lot of times people think, I can just diet and exercise, and that's going to take care of my lipids. Unfortunately, for the vast majority of us, that is not the case. So that's where medications have a big role. So it's a combination of diet, exercise, and medications, and then sometimes more advanced medications in order to get that particular patient to the right goal.
Dr. Wissam Gharib, cardiologist, Jude Guess, nurse practitioner, our guest this morning. Jude, I hope you've got your notes ready because you're up next. On the other side of this break, we'll go through what the clinic offers, where the lipid clinic is located. We'll go through all of that coming up here in just a moment. You're listening to Mon Health Talk this morning on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Wissam Gharib, cardiologist, and Jude Guess, nurse practitioner. We're talking about the Mon Health Heart and Vascular Center lipid clinics. And Jude, let's just talk about the lipid clinics for a little bit. What services, if you can give us an overview, are provided at the lipid clinics?
Well, in general, the lipid clinic is designed for people that have the elevated bad cholesterol levels and elevated total cholesterol levels that have been unsuccessful in their management through either their PCP or primary cardiologist. To help treat that, we use a multidisciplinary approach. We involve exercise physiologists, dietitians. Our goal here will be to manage the lipid levels from different aspects so that everything comes together. We also have a very wide array of medications that can be used. These range from pills to injectable therapies, and it's constantly changing, so it is improving all the time.
Physically, where are the clinics located?
Right now, the lipid clinic is in the 2000 building on 2000 Medical Park Drive, Suite 2300 in Morgantown.
And are they offered every day? Are there certain days that the clinics are open?
The clinic is starting out on Fridays, at this time, and we really expect that to grow and branch out into other days and perhaps other clinic sites.
And Jude, how does this factor in? We talk on Mon Health all the time about the holistic approach, and it's not just one system you're treating, but you're always trying to treat the patient with a team effort. So how does the lipid clinic fit into that overall role of providing overall health care and improving the patient's quality of life?
Well, it would be really nice if we had that magic bullet where you can give a person a pill and treat everything all at once. But really what it requires is, as Dr. Gharib alluded to earlier, when it comes to cholesterol management, you really got to look at the full picture in terms of the patient themselves with their modifiable, non-modifiable risk factors. You can break these down further by saying, the non-modifiable risk factors, these are things like the patient's genetics, okay? And those are a little harder to treat. They're a little more resistant to therapies. But you also have their age and their gender. Modifiable risk factors, these things are primarily from a cardiology standpoint. We look at helping to control their blood pressure, control their sugar, their diabetes, and to control, of course, their lipids. And the importance of this overall in the big picture is to reduce the risk of cardiovascular disease in the future.
Jude, am I going to be referred to the lipid clinic by my primary care physician or maybe Dr. Gharib, or can I just walk in and go, hey, I'd like to get my lipids checked here?
Well, it's really more for the referrals from the PCP and or another medical specialty for patients that have higher and more difficult lipid levels to control. General population, the good place to start is with your family doctor.
Bring Dr. Gharib back into the conversation. Dr. Gharib, let's say I go to my primary care physician for my annual checkup. My cholesterol's high. Maybe he wants me to go see you. What are the steps? Kind of take it from there. I've got high cholesterol. We need to just kind of get a handle on that. What are the steps we walk me through that?
That's perfect, because we really emphasize prevention. So those are the kinds of people we would love to see. So a patient comes in, like you said, has high cholesterol. Their doctor already put them on a statin or whatever, and they're still not at goal. So when they come and see me, I will look at their lipids and I will look at their types of medications that they're on. But we also look at all their other modifiable risk factors like Jude was talking about. So this is a great opportunity for me to say, hey, look, you're 40 years old. You're maybe not as active as you should be. Your blood pressure isn't as good as it should be. So this is a great opportunity for me to say, look, we need to maybe lose a little bit of weight, start exercise, and we give them kind of an idea of what's the best way to lose weight. How should you, how much exercise is good enough for you to prevent cardiovascular disease? Where's your blood pressure running? How's your sugar doing? And then now, how can we better optimize your cholesterol? If we're unable to take care of those things with the simple regimens that I just discussed, that's when we would say, okay, your cholesterol is maybe a familial type hypercholesterolemia, or is a more resistant type of hyperlipidemia or hypercholesterolemia. That's when we say you need more intense care. So I can see you every 6 months, every 12 months, whatever. But if I need a patient to have more intense treatment, that's when we would refer them to the lipid clinic, so that between our lipid clinic and the PCP and us, we can get them to the optimal therapy, to the optimal goal.
Dr. Wissam Gharib, a cardiologist, and Jude Guess, nurse practitioner, our guest this morning. Got to take our final break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Wissam Gharib, cardiologist, Jude Guess, nurse practitioner, our guest this morning. We're talking about the Mon Health Heart and Vascular Center Lipid Clinic. And Jude, can you just one more time give date and days and location that the clinic is offered?
Currently, the Lipid Clinic is only offered at our Morgantown office. That's 2000 Medical Park Drive, Suite 2300. And the day of the week right now it's offered is Fridays.
Jude, let's say we're doing everything right. We've gone to our PCP. We've seen Dr. Gharib. we're exercising, we're trying to trying to watch the diet, eat what we're supposed to, not eat what we're not supposed to, but we're still not able to hit that goal that we're looking for there. Walk me through what you would do at the clinic or how we would try to come up with a plan to reach that goal.
Well, the most important thing is to establish where we are in terms of the goal itself. How high are we? What is the current medication regimen? What kind of medications have been tried? And then we can get an idea from there where we need to go. Unfortunately, when it comes to the familial and hereditary types of hypercholesterolemia, like they are a little more difficult to treat, and they require a little more intense therapies. Fortunately, they've over the past several years, they've come out with the injectable therapies, and these usually yield some very promising results.
So I've heard both of you mention this a couple of times, and Jude, you may be doing all the right things, but you may have high cholesterol because it runs in your family. Is that what you're talking about?
Yes, that is absolutely correct. Fortunately, also, that is fairly rare to have a family history of hypercholesterolemia where it's on both sides, mother and father. A lot of times it'll be just one side or the other, and that gives us a little bit more of an edge when it comes to treating it.
But more often, is it likely you like to eat a lot of, I think it's, fatty red meat that adds to cholesterol? Is it more likely probably not watching the diet, trying to eat like you're 16?
Diet is very important for multiple other reasons. You know, the more inflammatory diet, the more processed food you have, the more inflammation in your body, the more atherosclerosis. But cholesterol in particular is only about 20 to 30% sensitive to diet. So the other 70 to 80%, we're making ourselves, our liver is making ourselves. And that's where a lot of people don't get the results they're looking for with just diet. So that's, you know, there is a familial hypercholesterolemia, that's what we were talking about earlier, but then there's also a genetic form where you have high lipids. And it's just something that is in your genes, something in the amount of exercise we do, et cetera. So those are the most common patients that we see where they have hypercholesterolemia, hyperlipidemia, where the bad cholesterol is high and the good cholesterol is low. And in those patients, we start off with diet and exercise, we add statins, and then we add the more, aggressive forms of medicine such as the injectables, et cetera, in order to get them to goal. So unfortunately, diet alone, in most cases, it does help, but it's not going to get us to the goal we're looking for. And then if you have a patient that's already had an event, that's where we have to be even more aggressive, where we can't say, oh, we're just going to try diet and exercise. We need to go to the next level medications.
Got about 90 seconds here. What can patients do on their own to maintain good heart health and maintain good cholesterol? You know what I'm saying? Good levels.
Yes, sir. Yes, sir. So you've already alluded to some of it. So diet, we say eat the rainbow. The more vegetables, the more types of beans, the more fruits that you eat, the better off. The less red meats, the better off we are. I'm not saying to eliminate it, but you definitely need to decrease it. So that starts off with diet. Exercise, I'm a big fan. I think minimum, all of us, 30 minutes a day. The American College of Cardiology recommends 30 to 60 minutes a day, 5 days a week. So we're really big advocates of exercise along with a good diet.
Jude, anything else you'd like to add?
Well, it's an ongoing process. It's not an instant in life. So, we need just to continually work on it throughout our lifespans.
Our guest this morning, Dr. Wissam Gharib, cardiologist, Jude Guess, nurse practitioner. Again, you can always find out more information by going to the website, monhealth.com/heart. Guys, appreciate you joining me here on a Monday morning. Thanks so much for the time.
Thank you for having us.
Thank you.
Absolutely. And again, more information at the website, monhealth.com/heart.